Thank you, Mr. President, for your leadership. It's good to be here today to announce FDA's recent decision. From the beginning of this pandemic, the President has asked FDA to cut back red tape to try to speed medical products into the hands of providers, patients, and American consumers. And I just want to echo the President's thanks to the more than 17,000 men and women who work at FDA. They have worked day and night to, in fact, do that. So plasma is the liquid portion of the blood. That liquid portion contains the natural immunity that someone develops in response to an infection, in this case COVID-19. And that liquid portion can be extracted, and for many years, as the President and Secretary Azar said, has been given to patients with infectious diseases for more than 100 years. So there was a really good rationale for why this might work. And in fact, as was mentioned, in early April, an expanded access program was started at the Mayo Clinic with the support of the federal government under President Trump's leadership. And that has gone on for the last 4 months. More than 90,000, close to 100,000 Americans have enrolled in this program, and over 70,000 have received treatment. This is one of the largest expanded access programs in the history of FDA, so a very successful approach to evaluating how convalescent plasma would work. So in the independent judgment of experts and expert scientists at FDA who have reviewed the totality of data, not just the data from this expanded access program, but more than a dozen published studies, as well as the historical experience associated with this, those scientists have concluded that COVID-19 convalescent plasma is safe and shows promising efficacy, thereby meeting the criteria for an emergency use authorization. In the optimal treatment, the optimal patients, as described by Secretary Azar, treated with convalescent plasma at the highest titers, there was a 35% improvement in survival, which is a significant clinical benefit. Now, we're waiting for more data. We're going to continue to gather data, but this clearly meets the criteria that we've established for emergency use authorization, and we're very pleased with these results. So let me just put this in perspective. Many of you know I was a cancer doctor before I became FDA commissioner, and a 35% improvement in survival is a pretty substantial clinical benefit. What that means is, and if the data continue to pan out, 100 people who are sick with COVID-19, 35 would have been saved because of the administration of plasma. We've seen a great deal of demand for this from doctors around the country, and what this EUA emergency use authorization today does, it allows us to continue that and meet the demand. And again, I want to echo the President's and the Secretary's ask of the American people: if you've recovered from COVID-19, please donate. It could save a life. And Mr. President, thank you again.
Thank you very much, Stephen. I appreciate it. Okay, any questions?
Mr. President?
Go ahead.